Good afternoon, everybody, and welcome to the Transport Innovation Talks. My name is Sharon Masterson. I'm the manager of the Corporate Partnership Board at the International Transport Forum. We're delighted you're all here with us today for our session, and I'd like to introduce the speakers in the panel that we have. So over here on the very left, we have Rob McInerney. Rob is the CEO of iRAP, the International Roads Assessment Programme, a registered charity with a vision for a world free of high-risk roads. After Rob, we have Mr. Satoshi Sugie, who's the CEO and co-founder of WHILL, a next-generation power wheelchair and personal vehicles, mobility devices, the Tesla of the sidewalk. Just to my left, we have Kalpana Viswanath, CEO and co-founder of Safetipin, a social enterprise that uses technology and data to advocate for gender-inclusive urban spaces and mobility. And then we have Paulo Humanes. Paulo is the Director of Mobility, Automotive and Cities at CEiiA in Portugal. CEiiA is a centre for engineering and product development, delivering cutting-edge mobility and engineering solutions for sustainable mobility. So first we'll start with Rob. Rob would like to give us a presentation. So Rob, over to you. Thank you.
Great. Thanks very much, Sharon. And it's lovely to see real people today, and it's obviously very exciting to be able to talk about inclusive transport with you all today, because at the end of the day, we will not reach the Sustainable Development Goals, we will not get to the climate change action, and we will not hit the safety targets unless we understand how we can create inclusive transport for everyone. And so I'll be talking about inclusive transport and 3-star or better roads for all. So just as some very quick background, iRAP is a charity with that vision for a world free of high-risk roads. Our major donor is the FIA Foundation, but we work in partnership with governments, development banks, UN agencies, research, mobility clubs, everybody ultimately who can help make roads safer. So that work's now extended beyond 100 countries around the world. Now, where I'd like to start with this discussion is to talk to you about uninclusive transport, because the reality every day on the world's roads is not only do close to 3,700 people die every day on the world's roads, we also see huge numbers of amputations, of severe brain injury. These injuries that are life-changing and are creating costs in the health system, in the insurance system of countries, are actually creating new victims who weren't there yesterday and are now excluded from transport because of the injuries they had in a road crash. So each and every day, there's 100,000 people suffering these sorts of life-changing injuries. Fatalities are just the tip of the iceberg when it comes to road trauma. And we are creating these new people who obviously have to tackle that devastating impact that road trauma has on an individual and their families and on the economy. So what can we do about it? I just wanted to give you one little insight which we've had from a monopoly insurance provider, government-owned monopoly insurance provider. And we've been able to generate some really powerful new insights. Because if we can understand the real trauma and tragedy that is road safety, then we'll start to respond on a scale that matters and create inclusive transport. So let's think about inclusive transport through the eyes of a child, a 0 to 15-year-old. This is from their data. 69% of boys make up the claim costs, sort of tied up with those sort of life-changing injuries, brain injuries, quadriplegia for young boys. 31% of the claim costs are young girls. Now what we've got is, interestingly, the passenger. Most of them are as passenger in vehicles. But you can see young boys as pedestrians is where that big disparity in that claim cost is coming from. And you can see the types of crash types here. Severe brain injury, there's the female component, or the young girl component, the young boy component. Interestingly, females, young girls, predominantly the internal injuries is where these are real injuries, these are real kids, these are real examples of uninclusive transport for young people. And what we've found is that, that the average claim cost on a one-star road for pedestrians is $240,000 per claim. The average claim cost on a five-star road for pedestrians is only $36,000. So not only is there less of them, the actual severity and life-changing impact of these claim costs are significant. Just to give you one other insight, from the analysis we did, there have been no severe brain injuries in 30 km/h zones for children. None. None. This is all possible if we start to have a real focus on humanity first. There's also an inequity by mode. And the first chart there is really to just say that when you go from a one-star road to a two-star road, you approximately halve the levels of death and injury for everyone on that road. Halving again going to three-star, halving again to 4 and 5. But let's have a look at the inequity by mode. We are all pedestrians. Let's not lose sight of the fact every one of us has a part of our day and a part of our journey as a pedestrians. 88% of travel for pedestrians on worlds we've assessed worldwide, 88% of those journeys are on 1 and 2-star roads. Levels of death and injury up here and here. For vehicle occupants, it's 44%. Motorcyclists, cyclists, not much better than pedestrians. We have a huge inequity by mode. And so that's our opportunity to start to challenge how do we create inclusive transport that delivers both our safety and sustainability goals. Likewise, when we move to the gender side of the equation, my colleagues Monica Ollislagers and Shana Lucchesi have actually done some really interesting analysis where we've looked at that inequity by gender. When we look at the modes that the different genders take, we can start to then map out the inequity of their journeys on 3-star or better roads, the UN global target. And we can see there's some disparities in Bogota where we've got that mix of the journeys they're taking by mode, but then we move it across to what proportion of travel for males versus females is on 3-star or better roads. And you can see that split between Bogota, Sao Paulo, Accra. Look at that, only 10% of all journeys are on 3-star or better roads for both modes, well, for all those modes in Accra, in Ghana. But again, a lens about the inequality and by gender. So that takes us to what do we do about this? And number one, the United Nations member states have agreed 2 global targets. Very simply, make sure all new roads are 3-star or better for everyone. And target 4 basically brings 75% of travel for each road user group up to that equivalent 3-star or better standard. 2 policy targets adopted by every country worldwide and achieved has the potential to save more than 100 million deaths and serious injuries over the life of those interventions. And so we're developing tools to help enable that. This example here, who'd like to guess what star rating this road is for pedestrians? 0. Great, correct. So there'll be a prize coming to you. It's 3-4 star for cars, but it's 0 star for pedestrians and cyclists. And so we're developing tools so that this can become visible at the design stage before the road is built. Capture it before a brand new killer road enters the infrastructure story of road safety. Likewise, we can see this start to inspire cities around the world who want to lead. Right? You've probably heard of Vision Zero cities, the cities who are really out there to be 0 road deaths and injuries. If they can be a 5-star city, where all journeys are 5-star, they'll be a Vision Zero city. And we're developing these standard design guides and tools to be able to help do that, and it's achievable. In China, we've actually seen public transport nodes, so metro stops, and they're making the 1 or 2 kilometre radius around that public transport stop 5-star for everyone. So that end of trip on a safe mode and sustainable mode like light rail or similar. Other innovations on CEiiA. This was trialled first in the Netherlands. It's now being rolled out on the Eurovelo routes in the Danube region in Europe, and we've got other pilots about to happen elsewhere around the world. And that's it's an interesting one. When we got in there, it was finding that in the Netherlands, one of their problematic crash types is a single vehicle bicycle crash, which is basically 7-foot tall Dutch falling off their bikes without helmets, but it's really causing a big problem in their injury burden. And so this is designed to actually start to really pick up the features of cycling infrastructure that impact all of the different crash types. We've also got a focused program around kids and their journey to school. If we can only start there and make sure every kid has a 5-star journey to school, that's fantastic. That can then inspire us to give everyone a 5-star journey. And that's already being rolled out in more than 50 countries, and we're seeing that success. And these kids go from a look of fear on their way to school to a laughter and giggling and chatting with their friends, as it should be. Livable cities, 5-star cities, sustainable cities. And we're also, with Botna Foundation and other partners in Vietnam, developing a youth engagement app. So we can have these kids themselves say, I'm scared here, I'm super happy there. And bring that into the decision making, really bring the community spirit along for the ride. All of this needs data. And so one of the things we're focusing on is using artificial intelligence to actually scale up the availability of this data worldwide. We're using satellite data in Vietnam to find where the high-risk schools are. In Australia, we're using TomTom's LiDAR data to automatically code the road features you need for a star rating. We have a similar initiative in the US focused on cities, about to begin with AASHTO. With the World Bank, we're working in Kenya and Ethiopia to use satellite data to get traffic volume and speeds. Powerful data for everyone to help drive inclusive transport for all. And then ultimately, this needs to be financed. And so that first chart that I put up about the level of claim costs and the cost of a brain injury and the cost of an amputation, we're actually building that into the financial models with the World Bank and the International Finance Corporation to develop road safety bonds that can sit alongside climate financing. So if you want safe and sustainable transport, you've got to be able to finance it and bring the facilities and the mode shift that will deliver safe and sustainable transport. And so ultimately, I've got a dream for a Footpaths for Africa impact bond that is funded out of the savings to the health sector from all the brain injuries, quadriplegias that would have happened to the kids and everyone who lives along those roads. Just give them a footpath or a sidewalk. So there's opportunities for this innovative financing, but at the end of the day, it all comes back to, if by 2030 we can make sure all new roads are 3, 4 or 5-star for everyone, we will get equity of transport, we will get equity of travel, we will get equity in our movement around society. Thank you very much.
Thank you very much, Rob. Just a quick question for all the people that are here from different agencies. How can countries, road agencies and cities set the right star rating? So what is your key advice to them?
Pretty well what I'd say to you is in the middle of your cities, where there's lots of pedestrians and cyclists, 5-star for those inner city cores, outside school gates, 5-star targets for them. Where there's not as many, 4-star. Where there's just a few, 3-star or better in line with the global target. Where there's no pedestrians or cyclists, you can obviously just focus on the other vehicle types. So that becomes very sustainable. And so basically, lots of users target 5-star, not many 3-star, somewhere in the middle is 4-star, and you can tailor those targets for what's right for the city, where their ambition is. But also it's always a combination of infrastructure spend and speed management. So it is achievable for everyone if you're willing to pull one or both of those triggers.
Great. Thanks very much, Rob.
Cheers.
So now, and I'll just let you know that we will have a question and answer sessions at the end, so we'll have a chance to ask your questions, so save them for later. So we'll move on to our second speaker, Mr. Satoshi Sugie, of the CEO of WHILL. Thank you, Satoshi.
Hi, good afternoon, everyone. So my name is Sugie, co-founder and CEO of WHILL. So we are based in Tokyo, and first of all, I'd like to show you the number. Okay, great. So here, 39.6%. Do you know what does it mean? Anyone? Okay, so I will explain. So this is the number of over 65 years old in Japan in 2050, yes. If you look at the graph, so Japan is the most aged society in the world. We are saying, everyone's saying like, aging society. No, we are saying super aging society. So back in 2010, I met a wheelchair user. He said, I've gave up going to grocery store, even just 2 blocks away. Why? So simply 2 reasons. The first, physical barrier. So if there's a slope or small bumps on the road, even a small thing is sometimes difficult to get to his destination. The second, psychological barrier. So he doesn't want to be seen in the wheelchair because wheelchair, still associated with some negative images. So simply 2 reasons. So think about and then researching a little bit. So it's actually related to the history of the wheelchair. Do you know what is this? Wheelchair, right? Wheelchair in 1932. What about telephone in 1932? Something like this. You're aware of it, right? So change a lot of things like in the cell phone. Even we say like, the smartphone right now. But what about the wheelchair? We see a small improvement, but it's not innovation happened a lot, more than decades, right? That's related. But if you look at the people who have difficulty walking the graph, 200 million people actually the people who have difficulty walking in the world, and they're growing rapidly because of aging society. So we are tackling this problem. The needs of mobility assistance for the senior is definitely increasing, and we are doing how we solve this problem. And then we start up in 2012. This is our first office in a suburb in Tokyo. It's tiny, tiny apartment. But anyway, so here's our mission. Our mission is deliver fun and innovative mobility for all. So all means regardless condition, regardless age, everyone. So here's our domain, business domain. If you look at like a horizontal axis shows long distance airplane, middle distance bus, train, and micromobility bicycle and scooter, we are focusing on very right side, indoor and sidewalk, walkable area. That's our business domain. So now we are providing spare hardware first. So the first one, we have 3 models. The first one we call Model C. If you look at the front wheel, it's coming from robotics technology. So it's go to the sideway, and they pivot on the spot, small, tiny radius, and ground covering ability for outside use. And the second model we have is Model F, which is folding, easy to travel, even airplane, taxi, and buses, and even handle types. This is all for walkable area mobility devices. So we are selling this, delivering this product more than 20 countries right now. And it's all devices connected to the IoT. So the customer can track device data, health, even we can provide an insurance, road service as well. And also not only the B2C customer, but also the places they can track fleet management system. So that this is really kind of useful even in B2B places. And recently, we started another service called Autonomous Taxi Service for indoor use. So we are providing this service into the airport and a hospital. I will show you how it works.
She now proceeds on her own, as no further assistance is needed from Amy or anyone else. She can stop at preset destinations, such as a restroom, coffee shop, or airline clubs on the way to the departure gate. The passenger reaches her connecting gate and exits the WHILL mobility vehicle. As the vehicle's task is now completed, it returns on its own to the disinfectant and staging area to be sanitized for its next task.
Yeah, this is how it works. So this connected actually like in a booking system, ID, user's ID, and then integrated system into the airport and booking system. So we are providing this kind of service.
She now proceeds.
So, yeah, so this is the, we say the autonomous taxi service. So why we started just, the autonomous taxi service is that people want to be independent, not, let staff pushing over like to the gate. So this is great to be independent. At the same time, for the B2B places such as airport and hospital, they don't need to hire like human operation. So now the COVID, kind of getting over, then trip like, travelers are actually getting increasing. So they have to hire the people, but it's difficult right now. So that's, they are actually want to have this kind of, the autonomous service in the airport. So kind of could be the various option for not only airport and hospital, but also like an amusement park, museum, those kind of facilities as well. Yes, so we are providing like this kind of like, the product and the service into 20 countries right now. What is the next step? What we are trying to do is that creating short distance operation system. If you look at in the middle, WHILL operation system. So not only like an airport, but also a lot of facilities, a lot of sharing companies such as like Lime and Bird, Tears, those kind of sharing companies, devices. So they want to connect us and in providing our service into those facilities in an area. So that's, if we create like operation system, so easily to connect, open up API and connect those areas as well. This is, for example, we collaborate with the Bird, kickboard sharing company. The reason why we collaborate with Bird is that actually Bird actually applied to New York tenders to provide their service, but New York City actually require to implement some accessible mobility services. So they are looking for the partner like us. And then we collaborate with Bird and then providing like our service to expand their customer and then meet New York City's requirements. So that's, now is, Bird application. If we put the button, then we can actually, they can actually provide a product as well. And then they can using our back system. So we are doing the system integration. So this is just for example, but ultimately, entire infrastructure will connect to those kind of mobility devices. So our mobility device, through our operation system, we connect it to like elevators, public transportation, taxi. It's all connected by an IoT through the WHILL operation system next 5 and 10 years. So lastly, I will give you like, inclusive innovation. What is the inclusive innovation? I think we will follow the history of glasses. What does it mean? So when I was an elementary school student, people wear the glasses mocked by the classmate. Why? It's because it looks not cool. But what happened today? Everybody wear the glasses, even like, regardless bad eyesight, good eyesight, Why? It's because it just looks cool, right? And what about next 5 and 10 years? Google Glass coming up, VR glasses coming up. It's no longer with pair of glasses. It's completely beyond something beyond. It's more different function. So what I'd like to say here is that all of the things that people think about like negative image go to the positive, and eventually beyond like this. The powered wheelchair, people might think about like negative, but we will follow this kind of glasses history, and we will create the world. Thank you very much.
Thank you, Sugie. And just a question on that. We spoke about the independence of the user. Yeah. Just the system around the user and the people that are around the user. How does it impact on those as well?
Yeah, so it's a great question. So yeah, it's impacted the individual, like actual user. But it's actually like, the surrounders, for example, the family members, friends, dears, they have at least like, let's say 10 people. It means like, 200 million plus 10, that means like, 20 billion. So I would like to say that it's not only the users, but also it affects like, the surrounders, such as like, friends and family in a positive way. So that's, creating an accessibility for him or her means making it happy for surrounders. That's what
it ensures that everybody can travel with that person. That's
exactly.
Great. Yeah. Great. Thank you very much. So we'll move next to Kalpana. Kalpana Viswanath.
Since everyone is standing, Rob started it, so I'm going to. It's certainly healthier and mobile. So, really to take us into a slightly different dimension, we've spoken about road safety quite a bit so far, but also in the introductory session panel. And one of the issues what do we mean when we say inclusive mobility, inclusive transport, inclusive cities? Satoshi gave a figure of 39%. But, when we talk about women or gender-friendly cities, we're talking about 50% of the population. And the other thing, which is very important to remember, and I do like to emphasize, that we should not use the term vulnerable populations, but they're excluded. Women have been excluded from the table when cities and mobility has been designed, and therefore it is really, women are not vulnerable users. Women have just not been the model or the standard when we design public transport or mobility. And this has been evident in things like what are those bags which come up when the word? Airbags, yeah. Or even a public transport. Some of them have improved now, but earlier when we got onto a bus, most of us women would find that, it was just a little higher than we could reach, because the standard is an able-bodied male that has been taken, and that has to change. So when we talk about gender-friendly mobility in cities, we're talking about how do we address the needs of 50% of the population, in some places more than 50% of the world, who are equal citizens of our countries. Now, one of the big issues which we do need to recognize in this is the issue of violence. It's the issue of sexual harassment. 1 in 3 women globally have faced some form of violence in their lifetime. And this has to be the bedrock upon which we build our equal and equitable mobility systems, because it's not just an issue of fixing the standards, but it's also addressing the fact that there is a political problem here. There is an inequality which we have to address. So there have been many studies, and this is not only a problem of the developing world, this is a problem that is global, and the statistics show that. But the other thing, and I think COVID-19 has really highlighted this, is that the work of care is actually the bedrock of our civilization. but it has not been seen as such. So when we think of women's empowerment, we have been thinking of how do we make women equal in the public space, in the workspace. But what COVID-19 taught us, if nothing else, I think important, is that the care economy is the bedrock upon which our entire societies are built upon, right? And it's invisible work. It is invisible work which became visible when everyone was sitting at home and had to see how much care work goes into just living the normal life that we live. These are some of the statistics, but it's like, it's actually staggering, the difference, the gender differential in care work. And unless we look at care work as something that becomes part of the way we design, not just our cities, but our mobility systems, because we have this notion of trip chaining, the way that women move, because traditionally when mobility systems are planned, you have a rush hour in the morning and a rush hour in the evening. You provide more buses, more trains at that time. But that's not the way that everybody moves in our cities. That's not the way that older people move. That's not the way that women often move. That's not the way children move. So how do we begin to design transport systems that are in fact truly equitable? Not just equal, but equitable. And I do want to say that the perception of unsafety is, simply the perception is enough to restrict the rights of women in cities. If you think that you're going to a city where it's unsafe, as women, you will automatically decide that you will not do some things. We have enough stories of women not taking up certain jobs because public transport is not good enough, because lighting is not good in those neighborhoods. And I really liked, the idea of the 5-star. How do we link some of these ideas together? How do we actually make sure that the 5-star is gender sensitive, but also how do we integrate ideas like that into work that we do? And I think it's very interesting. And similarly, the issue of the wheelchair, because it's not just the wheelchair, it's the fact that ability and disability is a very fluid thing, that at any point of our lives, any one of us can not be as able as we are today, from simply falling down, breaking our leg, breaking our hand, having to look after someone who's not able, getting old, which all of us have to do. And therefore, the care economy includes the looking after the old. And I think the model of looking after the old is not an older person who's completely autonomous and looks after themselves, but really is part of a community. So there are many factors that impact mobility, unsafe public transport and poor infrastructure, the walkability of streets. Walkability has come up as a single major consideration. If you have, in fact, you can almost interchange the parameters of walkability and safety. They actually, if you build a city that's walkable, it is safer. And that's why you said in the inner core, where people are walking, is where you need 5-star streets. Access to services, an unequal division of the work of care. I keep coming back to that. So I just want to talk to you about the organization that I founded, and it's a digital social enterprise, and we have several tools that are used to collect data about public spaces, about public transport and public services from different perspectives using different tools. The first one is an app we have which is called My Safetipin, which is a free app. You can all download it and take a look at it. And what we do there is based on a tool that we have called the Safety Audit, whereby we measure a series of parameters, which is both public physical infrastructure, that is lighting, walkability, etc., but also the social usage of a space. So how is a street used? Does it have a lot of activity, what we call natural surveillance or eyes on the street, or is it a street like in many cities that are coming up now where both sides just have high walls, and so there's no porosity in the edge of the road. So based on the safety audit, which people can do, who you download the app, and other data that we collect, we generate a safety score. So you can see the safety score of your neighborhood. You can download it and take a look. I don't know if we have much data in Germany. So until we have data, it doesn't get populated. But it is there in more than 35 countries across the world. We also have a feature which says nearby safe places. So if you are wanting to wait for someone, or wait for a bus, or wait for a taxi, you may prefer to wait in an area where there's a better light, there's a cafe, so it just tells you where is the nearer place. In India, the feature also integrates nearby services for women who are feeling unsafe. We also have a tracking feature, so if you're feeling a little unsafe in a taxi or walking, you can ask someone to track you. And finally, we have a feature called the safest route. So if you're going from point A to point B, it'll not show you just the quickest one, but the safest one based on our safety score. So this is one of the tools that we have for collecting data. You can do a quick audit. So this is actually, we're using artificial intelligence here. You just take a photograph of a place, and through artificial intelligence, we give you a safety score, and you just have to tell us whether you agree or not. So we're able to get more data from people. The second tool that we use is something called Safetipin Night, which is a very sort of really low-tech, cheap way of getting data that the Google car normally does, which is we attach a phone to the windshield of a car, and as it drives down, we generate images every 50 meters. And we use this method to map the entire street network. And then we use we started it manually, actually coding each and every photograph, but now we have shifted to machine learning to do most of it. We have a third tool called Safetipin Sight, and this is for in-depth analysis, spatial and qualitative analysis of certain spaces. We've primarily used it at public transport hubs. So in Durban, we've used it to understand the taxi ranks. So, are there public toilets? Is there good lighting? Are there waiting spaces that you can use? So it's a customizable data collection tool which allows you to generate images as well as with GIS location. So this we've used in many countries, in many cities, to get specific data. We've done one project on public toilets, looking at public toilets in cities. You'll be surprised to know that there are, we did a study that many cities in the world actually do not have enough public toilets. And therefore, women are unable to, for example, in the Delhi city I come from, in Delhi, one of the issues that came up when we tried to have more women bus drivers was the fact that there are very few good, safe public toilets for women on the streets. So we don't realize it, but public toilets are actually a big gender issue. Because unless you have public toilets, you cannot walk the streets freely. If you're constantly having to think, where is the nearest public toilet? Street vendors, women who work in shops, etc. So what do we do? So how does our work try to increase women's participation in cities? Because eventually, what do we want to do? We want women to be able to participate more in cities. So the data we collect, the outcomes we try and influence with city governments, and eventually the impact, which is access to public spaces, access to opportunities, and access to resources that the city has. So just to share some of the work that we have done in a few cities. So this is the city of Delhi. We collected data over 2 periods of time, 2016 and 2018, where in 2016 we identified the black spots were dark spots in the city. Dark spots were actually places where we gave a lighting score of 0. So not only was there no street light, there was no ambient lighting. So there was nothing that was lighting up the place. We actually gave this data to the Delhi government, who, interestingly for us, set up a multi-stakeholder committee to address the issue. And why I'm saying it's important to have a multi-stakeholder committee, because earlier we would go to the municipal corporation, they say, no, this is not our road, this is the Public Works Department road. And then the public would say, no, that's the national highway. So in Delhi, there are 17 authorities who fix roads and fix road lighting. I'm sure many of you would have had similar experiences. So they actually got together a committee, and everyone, they invited us, we spoke, we shared, we went with the engineers to explain the data, how we through the maps. And then they asked us to actually do a remapping in 2 years later. And we found that the dark spots had reduced, even though we had extended the scope of the project, if you can see, on the southwest of the city, which we hadn't done earlier. We had done it there, and nevertheless, the dark spots had gone down. So this was one. We've done some work on looking at specifically low-income neighborhoods and how young women get impacted by lack of safe mobility. So 44% women of the risk said that they felt unsafe at the audited points. And 84% of the points that were audited had poor walking conditions or zero. So that photograph you showed, I could easily say zero because that's what we also found. And therefore sexual harassment and fear, and then control. So a lot of people felt, oh, we shouldn't send our daughters out because it's not safe for them to go out. So therefore the impact of the lack of safety has many, many ramifications beyond just the lack of safety. It impacts opportunities. We did another project in, again, a low-income neighborhood in Delhi, which is very nice to look at the digital space also as a public space, because today the digital space is also a public space that we are all navigating. And we asked the young women in the neighborhood, as they moved around the city, to use Safetipin and map their journeys, but also to keep something what we called WhatsApp diaries. So WhatsApp everyone uses. So we said, anywhere you go in the city, just take a photograph and just write a line or a word about what you felt about that place. Did you feel safe? Did you not like it? Was it well lit? And we put it together into actually an exhibition we had it curated, and it was put up in one of the most crowded metro stations for a full month, where the commuters could then interact with the experiences of young women from extremely deprived backgrounds. And because part of the problem is I think many people don't understand what the other people are feeling. So I think when you're sitting in a position of privilege, you don't recognize sometimes what it is like to be someone who doesn't have equal rights, who is older, who is not as mobile. And so fostering those conversations is equally important to do. In South Africa, we've been doing a project in Durban with the eThekwini municipality, and it was very interesting because our partner organization there, the Soul City Institute, came up with this sort of comic strip about encouraging women why they should use the My Safetipin app and how it can help them. In this case, it's about running in public. This is a big issue. I don't know if men realize that for women, when you run in public, you have to think twice where you run. At what time do you run? Can you easily run at 10 o'clock at night? Not necessarily. How do you expand women's access to the city? So this was about a campaign which said, she deserves better. It was a hashtag She Deserves Better campaign that we did in South Africa, encouraging women to tell us where they felt safe running so that we could put that data together. And finally, we did an extremely interesting set of data collection projects in the city of Bogota, starting from actually 2016 till 2019, where we did data collection 3 times. A lot of the focus initially was on the bicycle tracks, on how to improve women's usage of the bicycle tracks, because women said that after dark they felt uncomfortable. So we engaged with the city government, who then engaged the local biking community. And the Safetipin Night app that I told you about, which we put on cars, they actually innovated and put it on the bikes. So the biker community became the way that we collected the data. So they bicycled through the tracks, they took the images, we then analyzed it, and then that data was used to decide where to put lighting, where to place the bicycle stands, so that women could take it and return it, where to place CCTV cameras, but also the data looked at how do you change public spaces through activity. So certain areas which were completely dead, even on weekends, the Secretary of Women of Bogota, they worked with local organizations and communities to have public events, to do other things to activate public spaces. Because if you have dead public spaces where people don't use, they become derelict, they become unsafe, they become more unusable. So how do you activate space? So public space, public transport, mobility, access, they're all linked, and we need to understand how to actually design and manage and govern our cities in ways that actually truly are gender transformative. These are some of the voices from the ground, from our users in parts of the world about how they used it, how it was simple. Some women have told us they use it when they rent a house. They want to see if the neighborhood is safe, because, or sometimes when they go to a hotel. So TripAdvisor tells you all about the hotel, but doesn't actually tell you about the neighborhood outside. You don't know. So we find that people have used it in very different ways, including in Bogota, in other parts of the world. And so, we are working with many cities. We're working currently in about 25 cities globally, in India and otherwise, and we're looking to work in more cities, have partnerships, but the app itself is free and it can be used by anyone. Thank you.
Thank you very much, Kalpana. Just a question on transport planning. How can transport planning become more inclusive for vulnerable groups, including women?
Well, the first thing is to get more diversity at the table when you're planning. So you don't plan for the others. You actually get the voices at the table, which I think is happening in more countries now. But and to recognize it's a very diverse set of voices we need to hear. It's not women is one group. There are women, there are young women, there are older women, there are migrant women, there are ethnic minorities. There's so many issues, and I think as we get more voices at the table, I think the sector itself begins to transform the way we look at transport.
Thank you. And I think it's an important point that you made earlier about the 50% and the way we look at it. I think we can also look at it as a market share.
Yes.
I think it's I think that's a very important point. So let's remember that it's that. Just a point on that. The ITF launched today a gender toolkit, and so we're delighted to be able to say that we'll be using that in all of the work that we do at the International Transport Forum on Transport Policy. And that's, if you're interested in learning more about that, my colleagues at the ITF stand will have more information on that. So we'll hand now to Paulo Humanes from CEiiA. So thank you, Paulo.
Yeah. So good afternoon, everybody, and thank you for the invitation to be here. So I want to talk about actually one of the safest countries in the world. So we don't have the same levels of problems, and it's CEiiA. And I want to tell you a little bit about CEiiA. Most of you know about Portugal, but you probably never heard of CEiiA, and I will not take it in a bad way. But we're a center for engineering and development of product development. This is actually our building. As you can see, it's a very nice city, a nice building in the city of Porto, in the north of Portugal. And we are basically a group of really smart people that do and solve engineering problems. And you might tell me, yeah, okay, but what does that really mean? So I want to tell you a bit about CEiiA, what we're doing outside of mobility, to then come back to mobility. So you might not believe this, but in Portugal, we engineered completely this airplane. It's an Embraer KC390, which was the biggest ever engineering project done in Portugal. And this plane is now flying around the world, used by many air forces. And it has all been designed by a Portuguese group of people in CEiiA. We focused on aerospatial. We developed a lot of helicopters, a lot of vehicles that are used in the aerospace element. But we also have another issue in Portugal, which is ocean. You might not know this, but also, if I say this statement, it sounds wrong, but Portugal has the biggest surface of any country in Europe. And this is true because of the element of sea that we have in Portugal. Our coverage in terms of the territory of Portugal goes all the way to the Azores, halfway in the Atlantic, and all the way south to Madeira off the coast of North Africa. So we have a huge area to cover, which is very difficult to monitor and to try to understand. So we need to monitor and explore that area. And the other thing you might not know about CEiiA, but some of you will enjoy, is that we are developing, for instance, on this case, autonomous boats to do all the monitoring. But as I was saying, this is the press, we are also doing things for the BBC. You probably heard of the Blue Planet program, where we are actually doing a lot of the imaging that you see on the programs. Those fantastic images, some of them are captured by CEiiA. You might see there's, behind this manta ray, there's a little drone behind it. And it's a way to follow the fish and understand what they're doing in a non-invasive manner. So after a while, the drone drops the fish, goes to the surface so that the high quality images can be used. So all this engineering was done in Portugal by CEiiA. And of course that in order to monitor all this amount of space, we needed to come up with space. And it became quite important for us to be able to do it. And we said the best way to do it about 2 years ago was to use satellites. So we decided, how do we set up a Portuguese space agency or start way to do it? And in the space of 2 years, we now have 2 satellites in space, and the last European Space Agency ministerial round was held in CEiiA, and we have these 2 satellites because we acquired these 2 satellites from a Spanish company. So we are now using these satellites for some of the purposes that I'm going to talk to you about. So, of course, the other thing that CEiiA has done, and this sounds crazy, but it was the pandemic, we developed a ventilator in the space of 45 days, and we produced about now over 1,000 in the period. In 100 days, we had over 1,000 ventilators that were distributed. But not on the medical field, not only the ventilators, but one of the things that people didn't realize is that during the pandemic, one of the big things was operations. So surgery was very difficult because doctors had to have an extra element of security, which meant that they had so much protection, they had tape around their hands and so on and so on and so on, that they could not breathe, so masks would fog up, and they could not communicate with each other. So in reality, the operations were being done blind. So what CEiiA has done with doctors, because of this collaboration, is developed a helmet that has a curtain of air instead of a visor, to enable them to operate with safety. And then we built in, as engineers that we are, we may go overboard with things. We put cameras, sensors, communication methods to do it. And at the moment, we are developing those elements. But let's go back to mobility, where I want to talk to you about. We started as an engineering center doing this type of vehicles. This is a car which was designed by CEiiA together with Pininfarina to celebrate Pininfarina and Louis Vuitton's big anniversary. It was 150 of one and 75 of the other one. And as you see, it's very much a niche car. I mean, they never were even produced. We then collaborated again with Pininfarina in the production of this Ferrari. It's a P45, and there's only one in the world. So again, not very useful for our discussions. But it allows us to understand and to be able to gain the capacity to develop a lot of things. So we developed this. You might see this as a funny little car, which it is, by the way. But this has been entirely developed and built in Portugal. Okay, with really innovative materials, using really local sourced elements. And the car is almost indestructible, and trust me, I tried, okay, when you hit it. And it's a huge success in Norway. And you might not believe this, but until a few years ago, it was the most sold electric vehicle in Norway, is this thing called electric body. And this was a story of success. And it enabled us to really understand what we want to do with this. But mobility is not about cars, and that's not what I want to talk to you about. But there is an element of a transition. We want to move to electric mobility. That was clear. And in Portugal, we embraced electric mobility in a way that from my point of view, because I just returned to Portugal after 25 years abroad, that no other country has done it. And mobility was seen as an opportunity to do that. Portugal today has, partly developed by CEiiA, by the way, one of the best charging infrastructures and architecture in the whole world. I can tell you that I lived here in Germany before, and I have an electric car, and I had about 4 or 5 cards in the sun visor that whenever I wanted to use, I needed to find which one do I use. In Portugal, I only need one, and it doesn't matter which one you use, and I always get the bill, because I choose to, because you can choose not to, I get it in my home electricity bill every month. And that's the way that things work. There was a huge investment. You might not realize this, but almost all of the fast chargers in the world today are produced by a Portuguese company, okay? Including the Tesla, it's just the box that's different, but they are made there. It's incredible what was able to do. And the element of the energy transition for it was incredible, and the opportunities that were developed by that. But of course, we wanted to do more, and mobility has to be more. And that transformation in terms of energy enabled us to understand that you cannot do that without other things. So one of the things that we did in Portugal, actually not me, there's a man there that did it, but I will tell you about it later on, decided to change public transport, for instance, costs, to enable these things to be more successful. Because if you get people out of the car and into public transport, and we have today a maximum price of a monthly pass of 50 euros for families, for instance, enable them to think about using public transport and then using some of the shared services. So we started developing all these ideas about a mobility that's not focused on the individual car, being electric or not, but being thought in a completely different way. And we needed to start thinking about how we're going to do this. So we started developing, in CEiiA, we started developing bikes. So Cascais, which is one of the world references of smart cities, we developed all the mobility system with them and all the architecture for developing, where we developed these bikes that you see on the picture. And yeah, it's great, we give them bikes, so what? What is clever about that? What's smart about that? What we started doing is starting to quantify what each individual was doing and how much contribution was he making to saving in carbon emissions. Okay? And from those carbon emissions, by detecting how much they were walking, how much they were cycling, how much that would potentially save, we were quantifying that and then converting it into a token or a credit that they can then use, and they could then either exchange it for services, for other services within the city, or convert it in cash. So you could think about that. But we also do it with tokens. So for instance, at the moment, as we speak, in Brazil, in the city of Itajaí, they are giving all their citizens the possibility of having an app where you can walk or cycle, you can quantify your CO2 emissions, and then convert those tokens into a bus trip. Because we're talking about people that don't necessarily have money to do this. So they can walk, cycle enough to save for a bus trip that they might want to go somewhere. In Portugal, we are using it in some cities to try to pay for parking or pay for taxis, so city services, okay? And we said, this needs to happen, but it's very difficult. So we decided to create, I can describe to you as a ZLT, in Portuguese it's a ZLT, or a technology-free zone, which is an unfortunate name, I have to say, because it doesn't mean there's no technology. it means there's a dispensation of regulation for technology to be implemented. But we decided not to do it on a corridor or on an area, but we decided to do it on a city-wide area. And we're talking about Porto and a big area of Porto, so with urban, peri-urban area. And that allowed us, for instance, you might not know, but we might allow us to start to, for instance, to fly drones, which in Europe is quite difficult because of legislation, to fly drones from hospitals for medical emergencies. So we can fly a drone from one hospital to another to deliver life-saving medicine, organ for transplant, or other supplies that they might require. So it's really, really incredible. And we decided to start thinking about it as an ecosystem of mobility. How can we create this vision of what we want to achieve? And we come up with lots of things, how to design the vehicles that will take the wheelchair users, because we are doing this. We're trying to think, how do we make sure that it's equitable for everybody, for women? How do we do it from a safety point of view? And we realize almost every day that there is going to be a lot of resistance in whatever we're going to do, because people have not thought about it today, and it makes it so difficult for them to think about tomorrow. It does not necessarily compute in their heads that we will change mobility this much. And we had to do something about it. So we wanted to understand, for instance, as I said, how satellites could help us identify where things will help us in terms of carbon and CO2 emissions. So we want to use satellites, for instance, to map and to reward people in different way, because the carbon reductions that we consider today will not be the same as we will need to consider tomorrow, because I say, I walk, I save this much CO2, and you say, compared to what? It's compared to a car trip. But in the future, we hope not to have a car trips. So what are you going to compare to? So you can't do it. So we need to understand where are the carbon concentration and where do we need to act and reward those acts. We are working on exactly this level. And so how do we do this? And the picture I have here, you see, it's two children. And they were with me 3 weeks ago, and they are both 13. And I brought these two 13 kids with me because we want to know how they think and how we're going to influence them. It's not the 19, 17-year-olds that are going to use mobility tomorrow. We wanted to know how these kids work and feel, and we get them involved in designing things, because we need to make sure, as we said, that they are inclusive for everybody, and that the innovation that we are doing is going to fit them and not us, because we, a lot of my generation, for instance, and Portugal sometimes is worse than some other places, we still see the car as the solution for everything. And it has not have to be the car, because it is the bikes, it is the walking, it is these new forms. And most of the things that we are doing is for them. So why not involve them in the process? And by the way, this happens to be two boys, but a lot of times we have a lot of girls, and we do have a big engagement. And what we are actually doing now at the moment in CEiiA is we have a 1 month intensive program with students from year 10 at school to the second year of university, working with them for a whole month to develop a prototype and for them to understand and work with us to try to come to this element. And we want to do that because, as I said, we want to have this input, because we have been preconditioned by different ways, so we are a lot working with communities and trying to get this information. And that's how we believe that's the only way that we're going to use innovation and engineering in a good way, is to really involve some of the people that will use it, not today, but in the future. Okay? That's all. Thank you.
Thank you very much, Paulo. So what I'd like to just do quickly now is just go to the audience, because I'm sure after the 4 presentations that there are some of you that have questions. I have other questions for the panelists, but I'd like to give the opportunity to the audience to get involved in the discussions. So have we any questions for any of the panelists? Yes, Anne? Wave out. There's a microphone coming in. Yeah. And perhaps when you ask the question before, you can just introduce yourselves, please. Thank you.
Thank you. Anne Fry, disability expert from the UK. Question for Paulo. You showed us electric charging points, but yours, like everyone else's, is not accessible to disabled people. It's too high off the ground. It's too heavy for most people to lift. Are you doing any work to make electric charging points accessible to wheelchair users and other disabled drivers so that they can share in the electric revolution?
Yes, there is a lot of that taking place, and actually one of the things that we are heavily promoting is, I'm saying this, and this is a bit might seem a bit contradictory, but we are actually telling people not to put chargers in cities, and the reason is because if we're going to look into the future, that's where we don't want cars. So why do we put the chargers there? And so we are focusing much more on the element of the home charger. And yes, there is a lot of element on how do we do it for disabilities, whatever type they are. And the weight of the cable, it is a concern, and it's a big concern. And I think you will be aware there's a lot of ideas of having basically robotic arms that can come out to help. But yes, it's a concern. It's something that it is being looked at. But of course, there's a lot of, how do you say this, commercial secretism and things, because of course some people want to be the first. Basically, when you get home, the car will charge itself without you having to do anything. There's been a lot of discussion about induction charging, but it doesn't seem to gain traction. But we have to think that in electric mobility, the way that the vehicles are charged and they are used is completely different to normal vehicles. Because, as I say, if we charge at home every single day, you don't ever need to, for most of the trips that we do, you don't need specific things. When you do a one-off long trip, yes, it's something that is still not necessarily always addressed, but it's something that is considered.
Thanks, Paulo. Any other questions? Yes?
Okay, thank you very much. Je vais intervenir en français sur la notation des routes. Le premier intervenant disait que
the first speaker said that pedestrians should give ratings for roads. What are the indicators? How can you best evaluate the quality of a road? What are indicators for that? During the first presentation, you had a scoring system, 3-star roads, 5-star roads, and you said there would be different ways of evaluation. Pedestrians don't always have the same perspective compared to car users. So what are your criteria for this scoring system?
It's the same infrastructure, so it's about perception. Okay, so he's saying, how can you ensure that when you're in a 3-star route as a driver, you realize that there's also a 1 or a lower star for pedestrians? So there's an inconsistency on the stars for the different user. So how do you relate to that?
Excellent, Mercy. Thank you for your question. The key part about the star ratings is that they are individualised to each road user group. So it is built on the road features and the evidence base that we know impacts safety for that particular road user. So it's very much tailored around that individual road user. So a pedestrian understands that this is a 1-star environment. that might be a school children on their way to school, and you can actually build that into their awareness just as much as you can build in the safest route from A to B for a vehicle occupant or a motorcyclist or a cyclist. So they are very much independent. They have independent road attributes that drive each of them, independent risk models. A road that is safe for vehicles may not be safe for motorcyclists, and we needed to recognise that. And it was interesting when we first built the models with the world's research agencies that built it, there was a demand for a single rating for a road, but we just couldn't do it because a 5-star road for vehicles might be 0-star for pedestrians, as you pointed out. So yeah, they are very much independent and presented as such. And I think the one thing that we haven't yet grappled with is where this sort of equity of access that you talked about is, there may not be any pedestrians at the moment, but if you gave them the safe infrastructure to use, they would. And so we're still thinking about how we can challenge the people using our models to think through that opportunity that's missing for mobility, for equity of access. And I think that's still a challenge we're trying to solve. But thank you.
Just here in the middle, we have another question. Oh, sorry, down here. Yeah.
It's Peter Kozijn. I'm a mobility expert and transport engineer. I'm an engineer, so I'm very keen on innovation and technology. But one of the things which is a concern for me is that we should not rely too much on innovation of technology to solve problems. We should be aware that there are also organizational innovation, social innovation, political innovation needed to go further. I give an example. My mother is 85. She does WhatsApp and FaceTime with her grandchildren, so she's keen on technology. She has a bus stop in front of her door and a bus stop in front of the station, and from the station she can go to the hospital. She has used public transport all her life because my father was a railway engineer, but she does not use it anymore. Not because she's too old or not mobile enough, but just because she is afraid of being alone at the bus stop and getting into trouble. And for her, technology will not solve that. I think it's also important to rethink transport in a way that staff is re-involved in transport. And technology can help on that. If you have unmanned vehicles, you can put an untrained person into an unmanned vehicle to help someone to get luggage and so on. So it's better than what we have now, because we need a driver who has a driver's license, who is checked, medically checked and so on. But I think that that's a major concern in innovation, which is from time to time forgotten.
Thank you very much. Kalpana, would you like to comment on that one?
Yeah. No, thank you very much. I think I always like to say that I think technology can be an enabler for change, but I think we should be wary of seeing, especially social change. And I completely agree with you that that's what I was talking about even when the wheelchair that Satoshi was talking about. There's also the element of the community, you know, like you said, your mother is a little uncomfortable about now going to the bus stop and being alone. And I think that sometimes, especially coming from a country like India, when I see innovation, the technology can be great. I think it can provide extreme possibilities that we had not thought of before. But it can carry in itself many problems in its as well. And so if we look, I mean, I'll just give two examples. One is, I think, what you're saying. I think the idea that we are autonomous individuals, but we are also social beings. And I think that is something that is very important to recognize, that as we grow older, for example, the model of old age care, which is primarily institutional, has been challenged in countries across the globe, saying that people prefer growing older in their own homes. Why? Because they're growing up in multi-generational communities. It's not as if old people only need to see other old people, and there are a lot of things that young people can learn from interacting with older people. So I think that keeping that social and cultural element when you're designing solutions, like Paulo talked about so many things. And the other one I think is, I constantly look at social media. Social media has provided so many opportunities for communities, for people without voice to have a voice. But it has also proved itself to be probably the most divisive tool that we have in the world today, and it is sort of causing this thing. So I think I do feel that we need to constantly be wary of anything, because I think every technology carries in itself the possibility that it can be harmful sometimes, outright harmful, sometimes go against what it was meant to do. So, yeah.
Yeah, so I think, your point is, I think it's great and then right. Sometimes like the emotional feelings definitely needed. It's difficult to solve like everything with the technology. But I think, going forward, having a staff is also very, very challenging. Because as I mentioned, over 40% is over 65 years old in Japan. And the labor cost is also going down. So that means, having a staff is also very, very challenging. So what we are trying to think about right now in Japan is that how we can create something like alternative, like robots, for example. More like emotional robots will coming up, for example. Otherwise, it's very, very difficult because elderly population and human labor, labor force is going down. So this is kind of a bit challenging. I believe not only Japan, but also all of developed countries is the same situation. So I think the point would be how we can create emotional safety things could be alternative like a human. I think that's something definitely we definitely need to solve without human operation. How to solve that problem.
I'd just like to make a quick comment on that, because I think it's a very important point. I mean, technology can bring us a lot, and we all know about that and innovation, but I think we also have to see, and as the speakers have said, how can we make it more inclusive? How can we ensure that it doesn't leave anyone behind? And we need to think a little bit more about that. So we'll go to, who had a question? Yes, here in the middle. Yes, this lady just here.
We should take a few questions.
Yeah, maybe we can take a few questions. Maybe we'll take one from this lady and one from the table at the back, yeah.
Okay, hi, my name is Mariana, and I am a PhD student in university in Paris. And I have two questions. So it's one for Rob. And I think I join our colleague in wanting to know a bit more about the indicators that build the ratings, actually. I think that's also what he wanted to know. So what are the indicators and who is building them? And also, if regarding the CEiiA app, is it only for kids, and is it only to get the perspective they have when they go through certain areas or the streets, and if it has some other objectives, or what has come up from that project? I'm curious. And last, I promise, it's for Satoshi. It's regarding the partnership with Bird. if is this something currently happening? Is it a plan? And what is the service being provided? How does this work? Just develop a little bit more on that. Thank you.
Thank you. And maybe we'll take the question from the lady at the back.
Thank you.
And then we'll go to all of the answers.
Thank you. My name is Claire. I'm from the International Transport Workers Federation, and I have a question for Kalpana. Thank you for sharing the work of Safetipin, which includes quite simple but very powerful ways to give voice and agency to women in terms of urban planning and mobility. The projects and tools that you described focus on improving safety for women in public spaces, but I'd be also very interested to hear your thoughts on what you see as the opportunities for using the Safetipin tools to improve safety for women who are working in public transport. Thank you.
Thank you. And maybe if we have another question, we'll take it. Steve, just up here at the top. And then we'll go to a round of answers. Okay, we'll take this gentleman down here as well, and then we'll go for a round of answers. So just up here first. Yeah, go on. Yeah.
Okay, I'll try and be quick. Just going back, Kalpana mentioned the question of culture, which I thought was an interesting one. So in the context, if we look at the European Commission is projecting that the rural population, they don't phrase it this way, but the rural population in Europe will halve by 2050. So a 50% reduction by 2050. So I'm just thinking in the context of inclusivity, and forgive me if I'm making, blunt assumptions, but a lot of what we've seen really talks about urban areas, and I'm just wondering, how can you maybe adapt or look at, or give me examples of some of the things that you're looking at where innovation maybe can overcome some of the disadvantages of living in rural areas and not only accentuate the advantages of living in the urban areas.
Great, thanks, Steve. And we'll take the gentleman just there, two tables down. Yeah.
Bonjour. Je suis heureux d'être parmi vous dans ce forum.
Good afternoon. I'm happy to be here with you because this is quite an interesting talk indeed. I use the opportunity to speak French because it's easier for me to communicate. I'm part of a project in partnership with the European Commission. It is called Fit for 55. This project aims at attaining climate neutrality by 2050. It comprises a mechanism to reduce CO2 emissions, which is an ambitious goal, indeed. And I often ask myself whether this mechanism will really get us there and whether we'll be successful in developing countries using this mechanism as well. How can we have an influence on other countries, and are there other countries that could actually benefit from our endeavors? Or do you know whether there are other studies? Are there any disparities? Are there parties that can benefit from it? In Switzerland, for example, there are many different options. Companies, for example, receive funding for compensation schemes, and in doing so, they have more money for implementing other measures. Would it be possible to compensate some damages? These are projects that aim at sustainable development, and of course, funding is always essential in this regard. Of course, there are certain disparities as well.
Paulo, may I start with the other questions first of all? So, Rob, there was a question to you about the indicators.
Yeah, excellent, and thank you to clarify that too. So the attributes that matter for pedestrians are sidewalks, safe crossings, the speed environment. So they're the top three. For the pedestrians, for cyclists, it's about separated cycle facilities. It's about making sure, again, that there is space with active and sort of heavier and faster traffic. That's separation. Is this the right answers that we're looking at, these sort of indicators in terms of the road features? And then when we move to the motorised vehicles, it's more about the alignment, the curvature of the road, that has a big impact, the separation of head-on and high-speed traffic. And let me just pause there for a second. Right now, our roads are designed that two trucks can travel towards each other at 100 kilometres an hour with a bit of white paint separating them. That's in our design standards. And the roadside hazards are a very big issue. For most high-income countries, sort of 30% of fatalities will be people leaving the roadway and hitting trees, rolling down embankments. So we're picking up all of those attributes and measuring those, and then looking at the research and the evidence base behind them to put valuations on risk for each. And that's all built into the star rating model itself. So yeah, that's what's behind the star rating. And there's also other features we collect that then can drive the economics of the upgrade. So this is ultimately about maximising lives saved per dollar spent. So we also pick up the features that matter for that. Coming to your second question, which is around the youth engagement app, the CEiiA app. So at the moment it's designed for use by children, and that can be either directly, but primarily we're rolling that out with the school teachers in the school environment, so that it does have an element of interaction and the group work behind that, but it also involves ensuring that people are safe in how they collect the data. We know better than anyone that you don't want them sitting at their device on this one-star road saying they're scared, because that would scare me. And so it is designed for that controlled school environment and working with teachers. But then from that, we start to identify these are the locations where the children are scared. We can then target the star ratings to those locations and ultimately target that transformation from 1-star to 5-star that's been driven by the kids. The other thing we hope comes from that as well is the little bit of the peer pressure that kids are best at, which is like, don't let your friend cross at a 1-star location. Like, even that little element coming into kids and how they use the safe crossing versus the unsafe bit without a crossing. Those little bits we can help influence behaviour and again the peer pressure and friendships that kids have to be able to drive better and safer journeys to school.
Thanks, Rob. The next question was for Satoshi on Bird. Yep.
It's a great question. So very simply say, it's in service, and the business model is the on-demand rental service. Unlike Bird, the Bird is everywhere, like capable. But it's what we're providing with Bird is that more on-demand rental, which is integrated our system so that we provide on-demand rental. This is actually a very initial stage, but we will see what's going to happen. But it's in service.
And Kalpana on the rural question from the table here.
Yeah, and I think the question
yes.
No, thank you. And I think one of the things we found, say in India, getting more women into the transport sector is a challenge, and is a challenge that we're recognizing we need data to do more things. And I think one of the things that's consistently coming out is, in order to bring about policy changes that can create that enabling environment, is the fact that you need more data. So I think the data that we collect and the kind of things that we do, we are finding that we're able to partner with other organizations. For example, I can just give you a quick example. In Delhi, for many, many years, many groups have been trying to get more women to be bus drivers. And one of initially the problem was the height of the of the design of the bus, so women couldn't this thing. So they needed a minimum height, and women never made it to the minimum height. Once the low floor buses came, we were able to get into that. But then they had a rule of you need a minimum 2 years experience of driving a heavy vehicle, and no woman had an experience because she'd never been a truck driver. She'd never. So in fact, last year that rule has gone. So even if they have 2 years of driving any vehicle, it could be a car, they could qualify and they would be trained and be given this thing. So I think for women in the transport sector, we need to constantly find data to understand how can we enable the sector to become more gender friendly, and even for people of other genders. I think that's something we need to look into as well. How can the transport sector be more hospitable to transgender and other people as well? And just on the rural issue, for example, in India, we're really looking at this rural-urban continuum, actually, because the city for us is actually spreading so much that it's the peri-urban areas are neither rural nor urban. And so how do you differentiate actually the urban and the rural over time? I think a sociological category with communication, with media is actually changing. So other than the fact of occupation, there is nothing that is so definingly different in many countries now, because the cities are expanding and this thing is moving. So I think as we're looking for solutions in the future, I think that if we keep it in mind, we might be able to be a little more innovative in trying to find solutions that address both, and as well as the linkages between the rural and the urban.
Thank you, Kalpana. And Paulo, to the final question.
Yeah, there's a lot of levels in the question that you made. So in terms of, there's an aspiration to move to carbon neutrality by 2050, and I have to be honest, I think it should be accelerated even more. And I will explain to you why. Because one, if you accelerate it, you're going to make that a lot of people will not be able to catch up with that change. So when cities say, I want to burn internal combustion car engines from cities, I would say do it as fast as you can. And the reason is because you're going to not be able to get everybody to transition to electric vehicles, for instance. But see that as an opportunity and not as a problem. Use that as the way to put the services around that will ensure that they will never go back to having a car. And that's what I'm trying to do. What that means for developing countries that will not be able to do this, I totally agree. But we have a carbon trading market that needs to be established, and that is taking place. And yes, there is a valuation on the carbon ton, but at the moment it's voluntary. And that voluntary element is going to make that a lot of the trading is going to take place in the developing world for a number of reasons, rightly or wrongly. It's what it is. For instance, last month, on the 29th of April, there was the first ever carbon auction that came from bicycles. And it came from Brazil. And it was in, I think, Rio, and they looked at the bike sharing scheme and how they quantified that CO2, and then they had an auction. I know the base auction bidding price was $7 per ton. I don't know what's the result. But that will mean that in a lot of countries, developing countries, they will be willing to accelerate the process, because if you can quantify it, you'll be able to negotiate it. And I can tell you that at the moment, we and CEiiA and Portugal is embarked on a project in a small island in São Tomé and Príncipe, which is off the coast of Africa. The island of Príncipe, they want to go and electrify the mobility. And then you tell me, hold on, but this island has no tarmac roads, has none of its they generate no energy. So all the energy comes from diesel, So why are you going to do there? And I tell you very briefly what we want to do. We want to bring electric bikes, and we want to bring electric bikes because it's the closest thing to a motorbike that they use, okay? We want to enable them to develop transformation and change on the bikes, to enable them to create their own accessories, to create their own trailers, the way they want to adapt the bikes. We want the bikes to be charged using solar panels, that we are going to install the solar panels in cafes so that they can charge the batteries and swap, to have a mechanism of swapping batteries. So the battery comes out. And the batteries have another function, is the batteries are actually have a USB plug as simple as this, so it's not high technology. And this USB plug will be able to be used if they take the battery of the bike to light the house where they live or to charge mobile phones. And the idea is to create a circular economy where they can quantify their carbon emissions by avoiding the entrance of diesel fuel to do this. It's again the old story that there's a potential for a quantitative jump, but that quantitative jump can come if a lot of things are in place. But I really believe that we are on the good path to do it. But again, a lot of the things that are going to happen in developing countries depend on what some of the developing countries do. Because if we don't make the change will also never come to the developing countries because of this trade that we need to be conscious of, and we need to do it. And we need to do this in a way that makes it inclusive for everybody. And for me, transportation can be that element and mobility of change, not only, as I said, in mobility in people's lives, but also to bring some of the things to some of these developing countries.
Well, thank you very much, ladies and gentlemen. Thank you for thank you to the speakers. I think they've done a great job. So to Rob McInerney from iRAP, to Satoshi Sugie from WHILL, to Kalpana Viswanath from Safetipin, and Paulo Jimenez of CEiiA. And to you, the audience, for all the great questions. We're now at about 6:10 in the evening. I know that our Moroccan colleagues have a wonderful reception planned for us this evening downtown. So without any further ado, I'd like to thank you, the audience, for being with us this evening. We'll give you a big round of applause as well for all the great questions, and we'll see you later on. Thank you.